Thanks so much for joining us for today's presentation, Copay or Premium Financial Assistance in Less Than 5 Minutes, presented by the HealthWell Foundation. I'm Carla, the Director of Education and Partnerships at NeedyMeds, and before we get started, I'd like to offer some tips so you can make the most out of today's presentation. First of all, you can ask questions at any time by typing them into the questions section of your GoToWebinar control panel. Just know I will reserve answering questions until the end. If we don't get the chance to answer your question, we will follow up with you by email. Of course, we'll provide the contact information for NeedyMeds and the HealthWell Foundation at the end. Also, I want to let you know the webinar is being recorded and will be posted to the NeedyMeds YouTube channel. And you can find copies of our PowerPoint slide decks in that handout section of your control panel. So let's dive in and get started with what is NeedyMeds. For those of you not familiar with us, NeedyMeds is a national nonprofit founded more than 2 decades ago by a retired family physician, Dr. Richard Sagel, and his friend, Libby Overly, who was a medical social worker. Rich is still the NeedyMeds president. Bear with me one moment. There we go. That's the screen I was looking for. What I was going to say right here is on your screen is all of our formal wording about our mission statement, a statement about how we achieve our mission, and our vision statement. But simply put, NeedyMeds connects people to programs that will help them afford their healthcare expenses. And we do that free and anonymously through our website, needymeds.org, and helpline 1-800-503-6897. So what you're looking at now is the home page of our website. And I like to put this up because our website is really the face of our organization. And I hope you'll agree just with a quick glance of the screen that our website is full of information. So I encourage you to browse it further when you have time. For now, I just want to point out a few resources. If you're looking for a healthcare cost savings program, you'll want to begin your search with the Patient Savings tab. The Advocates tab next to that is where you will find our educational information. You can sign up for webinars, our monthly e-newsletter Vitals, and order brochures, for example. I mentioned that today's webinar is being recorded and that you'll be able to find that recording on our YouTube channel. You can find a link to that on the top right of our homepage with the rest of the social media icons. And you can also check out and register for future webinars on the calendar of events on the bottom right hand of our homepage. So as you saw on our mission statement slide, a big part of our mission is educating people. And we really do that in 2 ways. First of all, by letting people know about NeedyMeds and educating them about the healthcare savings resources we offer, but also by educating others about additional savings resources, which is why we are so pleased to have Fred and Jeremy from the HealthWell Foundation here with us today. And before I introduce them, I just want to make a quick statement about what the HealthWell Foundation is. They are a leading nonprofit dedicated to improving access to care for America's underinsured. Their mission is to reduce financial barriers to care for underinsured patients with chronic or life-altering diseases. Basically, when health insurance is not enough, they fill the gap by assisting with copays, premiums, deductibles, and out-of-pocket expenses. So now let me tell you a little bit about our guests from the HealthWell Foundation. Jeremy Abundy, the manager of Provider and Pharmacies Relations, joined the HealthWell Foundation in August. Jeremy serves as a liaison to physicians' offices and pharmacies and is responsible for coming up with the most efficient methods to increase stakeholder engagement on behalf of the patients they serve. Bringing over 16 years' experience, he most recently served as Director, Corporate Social Responsibility, Government Affairs, and Public Policy for Mallinckrodt Pharmaceuticals. Jeremy has a master's in healthcare administration from the University of Maryland, University College, and a BS in kinesiology from the University of Maryland, College Park. Our other guest, Fred Larby, is the Director of Operations who joined HealthWell Foundation in 2016 and serves as a member of the HealthWell Senior Management, overseeing corporate strategic operations, and Fred is responsible for the day-to-day operations of HealthWell's direct contact center subsidiary. Fred brings over 9 years' experience in the copayment assistance arena to the operations team and earned his BA in marketing from University of Ghana and an MBA from Lemoyne College in Syracuse, New York. So without further ado, and hopefully seamlessly, I'm going to pass the mic and the screen to Jeremy to kick off the presentation, and that may take just a moment. And as Jeremy goes ahead and grabs that screen, I will remind you that if you do have questions, you can go ahead and type them into that questions section of your GoToWebinar control panel. And with that, Jeremy, take it away. Thank you.
Thank you so much, Carla, for that wonderful introduction. Good afternoon, everyone. Thank you for joining us. Fred and I are really excited to be with you today to outline the HealthWell Foundation, what we do as an organization, but also present to you how to apply for copay and financial assistance in less than 5 minutes. It really is that easy. We've worked very hard, HealthWell has, I should say, to make this process as seamless and quick as possible, and we're going to highlight that to you today. I'll walk you through step by step how to apply for a program. We'll outline the portal, things such as that. So let's get started. My name is Jeremy. I am the manager of provider and pharmacy relations at HealthWell, as Carla said. Session outline for today, we're going to discuss a little bit about what is charitable patient assistance programs, for those of you that may not be familiar. We'll outline the HealthWell Foundation, introduce you to our organization, to our disease funds, what it is we do here. We're going to walk you through the application process. It is quick and easy as promised, and that's why you all are undoubtedly here today. And then Fred's going to highlight our patient portal. We've got some new features there that are really impressive. We're really excited about to offer those to you. And then he'll highlight some pharmacy and provider tools as well that we're happy to bring to you that will really change the way people are utilizing the portals and accessing grant information. As Carla said, at the end, there'll be time for questions. And we realize this is a lot of information, so we will provide you with our contact information. If you have questions outside of the webinar today, feel free to reach out to us. We'll be happy to answer those to you at a later time. So patient assistance, what exactly does that mean? What is it? In broad terms, it encompasses both patient clinical educational support and financial support. And within financial support, it's sort of broken down into 3 different segments. You have what's called manufactured sponsored copay support. Those are copay cards or coupons that you may be familiar with. Then there's foundation support. That is for patients that are experiencing financial hardship and are underinsured for medical expenses. They come through organizations such as HealthWell Foundation and apply for charitable patient assistance programs. You'll often hear that referred to as CPAPs. Finally, the 3rd tier of financial support are free drug programs. Typically, these are for patients that are without insurance or for patients that have insurance but do not have coverage for that particular drug. So let's dive a little bit deeper into foundation support, or CPAP as I referred to it. These programs, these foundations provide financial assistance to patients with insurance, and they're different from manufacturer copay support in a number of ways. First and foremost, assistance is not product specific. Eligibility requirements must include income limits and verification requirements. Assistance covers all drugs in the class, so branded drugs, branded generics, and generic products that fall within that specific disease fund. Assistance is provided via a grant from the foundation, in this case, HealthWell, and Medicare beneficiaries are eligible to receive assistance. So the CPAP community, as it's referred to, is made up of a number of organizations, and I've provided the information there for you, their contact numbers and website. You'll see that HealthWell Foundation is listed there as well. And collectively, as a group, that community, CPAP community, provides on average about $1.6 billion annually in estimated financial support to patients. So as I mentioned, HealthWell Foundation is part of the CPAP community. And I just want to give you a little bit of background beyond what Carla provided to you as far as what HealthWell is, what it is we do, and the assistance that we provide. We are, as she mentioned, an independent 501c3 national organization. We're based here in Germantown, Maryland. We were established in 2003 to improve patient access to life-changing medications. And since we launched our first fund in 2004, we've been able to provide assistance across 73 different disease areas. As of December 2019, we have over 130,000 active patient grants, and we were the first foundation and of only two to have a written OIG opinion that allows us to operate only to Medicare beneficiaries. Currently, about 91, just shy of 91% of our grantees are Medicare patients. And the shining star in what we are as an organization, 100% of all donated dollars go directly to patient aid and grants and services. Donor dollars are not used for fundraising or any administrative costs. And since our inception, we have provided approximately $1.6 billion to over 500,000 patients, and that's across over 750,000 grants. And I mentioned since our inception in 2004, we've been able to provide a number of different disease funds. I'm not going to go through this list, but this is just an example of all the different disease states that we're involved in. And so now we'll jump into the meat and potatoes of the presentation today, why it is you're here, how do I apply in 5 minutes or less. The grant process itself is very straightforward, very friendly. Before you sit down to begin an application, you're going to want to gather this patient information, specifically age of the patient. If a patient is under the age of 18, we'll need parent and guardian information, their legal name, address and phone number, insurance information, their social security number, household size, and annual household income. And so you may be asking, how do I qualify for assistance? What are the requirements? It's pretty straightforward. You must have health insurance, either major medical or prescription drug coverage. Depending on the fund that you're applying for, your income must be less than 400 or 500% of the federal poverty level, respectively. Again, that depends on which fund you're applying for. And you must be receiving treatment for a specific medical condition for which funding is available. Next question, obviously, is how do I apply? As patients and or caregivers, you can apply in one of two ways. Either visit our website, healthwellfoundation.org, or by phone. You can call us at 800-675-8416, and the number's there for you in case you need that at a later time. It's important to designate if we have any providers or pharmacist representatives on the phone today. You may also apply on behalf of your patient. The mechanism is a little bit different. You wouldn't use the online application, but rather the provider or pharmacy portal, respectively. When a patient applies, they'll receive instant notification of approval, and an approval letter will be sent to that patient. And via the portal, the pharmacist may also download that approval letter for those patients. So now that we've established that, let's jump into how to apply. Where do I go? What do I do? The first thing you're going to do is visit our website, healthwellfoundation.org. You see a screenshot of our homepage in front of you. The first thing to do is to check the disease funds to make sure that the medication that you're requesting assistance for is actually covered by one of our funds. So you'll see a blue disease funds button at the top center of your screen. You're going to click on that. When you do, you'll see a list of disease states that come up on the screen. You'll choose from that. Once you choose the specific fund that you're interested in, you're going to land on a detail page, such as the one that you're seeing on your screen right now. There you can find things such as status of the fund, maximum award level, household income, whether it's 400 or 500%, again, depending on the grant and the type of fund. And most importantly, the treatment's covered. And this is where you're going to want to check to make sure that the medication that you're requesting assistance for is listed and part of a fund that's accepting applications. Once you've confirmed that, you want to navigate back to our homepage. There, you'll see an Apply Now button. It's a red button at the bottom left of your screen. Click that Apply Now button to apply. This will take you to a patient attestation screen. Or I'm sorry, an application instructions page. Take a few minutes to review the application instructions. A couple of things you'll want to note as you read through this, and please do take the time to read it. If you are privately insured, that is, you do not have Medicare or Medicaid, and you've not yet contacted your manufacturer of your medication to inquire about assistance, We ask that you do that so before applying. The other thing to keep in mind is please only submit one application at a time. Submitting multiple applications will not serve to expedite your application, and in actuality will actually serve to only slow down and clog the system. So please keep it to one application. When you've read through and you're ready to proceed, click the continue button. And you'll come to a screen that says, let's get started. There, you're going to indicate whether or not you're the patient and that you are 18 years old, or in the case if you were a family member, you would obviously check that button. Again, to reiterate for healthcare providers or staff, any pharmacists on the phone today, this is not where you would apply if you are applying on behalf of a patient. You're going to want to go to your respective portals in order to do that. So click the button indicating that you're the patient and you're 18 or you're a family member, and then click the continue button. This takes you to which fund you're applying for. You'll see the list there. Choose which fund you're applying for and click the continue button. Now you're going to land on the medications list. You must select all medications that you're currently taking, and you must be taking at least one medication that qualifies for the fund in order to be eligible. Once you've selected all of those medications that you're currently on, indicate whether or not you have insurance for those respective medications and click the continue button. This brings you to the page which will ask you about what type of assistance you are requesting. So there's two types. There will be copay assistance, and then you'll see premium assistance beneath that. If you select copay assistance, you're asking HealthWell to assist with the amount you pay after your insurance company has paid for the qualifying medications. By contrast, if you request premium assistance, you're asking HealthWell to assist with the amount you pay to your insurance company to have medical or prescription coverage. Once you make your selection, click continue. And again, you'll land on the manufacturer's page, manufacturer's program information. Again, like I said, if you have private insurance, the manufacturer for your medication may offer a program. We ask that you contact them to verify that. Or once you've done that, or if you are in the case of have a Medicare patient, indicate as such, and then click the continue button. This brings us to the patient attestation page. Please take a moment to review this, read each bullet point thoroughly. The purpose of this is to confirm that the information that you are providing is true and accurate to the best of your knowledge. Check the box to indicate that you have read, fully understand, and agree to the attestation, and then click the continue button. That will take you to the income verification attestation page. Take a moment to read through this as well. You want to note that agreeing to the income verification, you are authorizing HealthWell to have a third-party service consult your credit profile and other information in order to verify your income. Once you've read through and agree to that, click the continue button. And also, please note, if you choose I do not agree, that will actually cancel your application. So please pay attention to which button you're selecting before you hit continue. Continuing on with income verification, you'll want to select the state that you live in from the drop-down menu, then enter the number of people in your household, and then your annual household income, and click continue. That will bring you to the patient information screen. You'll see a lot of information required there, including your name, your social security number, phone number, mailing address, and such. Please complete all required information and then click the continue button. From there, you're taken to a provider information page. This is extremely important in the event that we need additional information from your doctor in order to continue the management of your grant. We will reach out from time to time to obtain that additional information. So it's really, really useful if you provide us with your doctor's name, their contact information, phone number, and fax number. Once you've done that, click the continue button. And you'll be asked to enter your insurance information. Your primary insurance information is required. We'll need that to validate, eligibility for the program. And if you have a secondary or tertiary insurance plan, please include that as well. Once you've provided all of that information, click the continue button. And that will take you to the alternate contact screen. This is where you can choose to indicate whether or not you want somebody else to be contacted or have the right to access information on your behalf. If you want us to share information regarding your grants with a family member, you must designate that person here. So if you choose to do so, please provide that information. Once you filled in their name, contact information, please click the continue button. And just like that, you're almost done. You've arrived at the final review page. This is going to show you all of the application information that you've provided. Please take the time to read through this thoroughly, make sure everything is accurate and complete. And once you're ready to move forward, click the submit button. If there are any edits that need to be made, there are edit capabilities on this page. You can go back and edit anything as appropriate. But once you've done that and you're ready to move forward, click submit. And just like that, congratulations, you successfully submitted your online application. It's just that easy and just that simple. Once you've done so, we offer patients access to instant pharmacy cards. We offer direct billing with providers and pharmacies, and you're eligible to reapply after 12 months. And there are a number of funds that are replenishable throughout the year. Examples of those are the ALS fund and the gout fund. So that information is on the website as well, for those of you that's applicable to. So now that we've reviewed the application, you're all experts and ready to log in and submit. I'm going to hand it over to Fred. He's going to walk through the patient portal, highlight some exciting new features that we have to offer, and walk you through how to utilize those. Fred?
Thank you. Thank you, Jeremy. Okay, give me a second here to show my screen.
And as Fred is setting up his screen, I do want to remind everybody, I do see some questions coming in, and you can go ahead and type those questions into the questions section of your GoToWebinar control panel. A reminder also that if we don't get the chance to answer your particular question, don't worry about it, because we will provide you, of course, with contact information for the HealthWell Foundation at the end of the presentation, as well as NeedyMeds. And of course, so you can always reach out to us directly, or we will follow up with you via email. So with that, Fred, take it away. Thanks, everybody.
Thanks, Carla, and thank you, Jeremy. My name is Fred Labby, Director of Operations here at HealthWell Foundation. My job really is to ensure that we have processes put in place to get a grant, seamlessly into the hands of patients. And that's what we do every day, and we continue to perfect our craft. So as stated earlier by Jeremy, there are three main access points for securing a grant at HealthWell. You could do that through the hotline, and the number is on your screen, 800-675-8416, where you can actually speak to a foundation specialist who can help you through applying for a grant. But then you can also apply online through our website, and that's what Jeremy just went through with you. And there's also the portal for just providers and pharmacies who can actually apply on behalf of their patients through the portal. So Jeremy just took you through the step-by-step process for enrolling online. I will focus now on how to access and use the patient portal, which provides the following functionalities. Number one, the portal will give you access to your grant detail. And two, it will give you a view of your payment activity. Number three, it will give you the ability to upload documents, which is a pretty good function. And then finally, you get to be able to subscribe to our fund alert. So basically, you subscribe to a fund that you want to be notified of when the fund is open or closed. So we're going to go through that. But first of all, you go to our website, healthwellfoundation.org, and navigate to the portal section. When you click on the portal section, it will take you to the screen where you get to select patient portal, and that takes you to the login screen. Obviously, for patients that already have registered for the portal, they get to access by simply entering their email and password. Those new to the patient portal will need to create an account. So they just click the create account link over here, and all they need will be to enter their HealthWell ID, which is provided on the approval letter that they will receive when they are approved for a grant. And then they have to provide a date of birth and an email address. The email address they want to use for receiving alerts and accessing the grant. So with that information provided, they just click the create your account button, and they will receive an email that will allow them to choose a password, and they can come back to this screen, enter their email address and password, and that takes them into the portal. So now, the very first thing I want to talk about is the document upload feature. It takes you right to the patient tab. When you click on the patient tab, the upload document feature is front and center. And we want to talk about that first because that seems to be the most popular feature right now. So the patient tab gives the information about the patient demographics. So we will have the patient name, the gender, their age, date of birth, and then the HealthWell ID. That basically allows the patient to know that this is actually my grant. This is my information. So they get that information, and then with that, there is also the related grants that they have. So in this case, for this particular test patient, they have the fund or a grant under the fund for Cushing's disease. Um, so what they have to do is click the upload button if they are looking to upload a document. And with that, it brings them to the screen where they get to select the type of document that they want to upload. It could be a diagnosis verification form or a proof of income, explanation of benefits, all types of document. And if it's not listed in the drop-down menu, they can just select other and indicate what type of document that they are uploading. And with that, they click the upload document, and the document is uploaded. The good thing here is that as soon as the document is uploaded, it gives the patient the status of the document. And there's also a case number, which basically links this document to a case in our grant management system. This actually facilitates any call, makes a call to our contact center easier because the caller or the patient can indicate or refer to the case number that they are calling about. It also gives them the status of the document. If it's, in this case, it says pending. When the document has been reviewed, it will show that it has been reviewed. Then also the document tab will now list all the different documents that the patient has uh, uploaded in the past, also showing the statuses. So as you can see here, the diagnosis verification document here has been reviewed. It shows the case number, and then it also shows the date. And the one that is pending also shows that status. So all the documents that a patient uploads, we have a list view of them, uh, you know, right in front of them. The other feature is the grant tab. When they click on the grant tab, it takes them to the grant that they enrolled in, and it gives them the details of the grant. What they have to do is click on the name of the disease fund they enrolled in, and it gives them the pharmacy card information, which is one of is pretty important information for them to have because they can provide that information to a pharmacy for to submit a claim on their behalf. So it shows the name of the patient, the status of the grant, and the start and end date, the end date of the grant, and the grant balance. These are, as you will agree with me, these are very important information that for the patient to have. Um, in this case, it said the status is withdrawn, which is not unusual. Sometimes patient can enroll in a grant and decide that they don't need it anymore. So we can go ahead and withdraw the grant. So that's why you see it there as withdrawn. Or status sometimes will also show as active. Um, Now let's go next to the payment tab. The payment tab displays all the payment activity that has transpired under the patient's grant. And it shows obviously the name of the patient, the status of the payment, the service date, and the amount that was applied. It also shows the name of the drug or medication that has been paid for the patient. And the last tab is the fund tab, which basically is also exciting news we have for you. For patients, they now have access to the fund tab and a list of all the funds that HealthWell is assisting with. And with that, they can sign up for our real-time fund alerts. So basically, they click on the fund tab and select the fund that they want to get alerts on. And that's simply by clicking on that, it gives them an option to subscribe to the fund alert. When they are subscribed to a particular fund, any status change on open or close will trigger an email notifying the patient of a fund being opened or a fund being closed. Now, one of the things I wanted to point out is that if a fund is closed and the patient is enrolled in that particular fund, it does not mean that they no longer have access to their grant. They have access to their grant for a 12-month period. It just basically means that we're no longer accepting new applications for that particular fund. Good thing is that the portal is also mobile friendly, so patients can actually, receive the fund alerts right on their phone, their smartphones. They can also access the portal through their phone on the go. So that's a pretty cool feature that we're providing patients at this time. Now, I didn't want to complete or conclude this without mentioning the pharmacy portal. Pharmacy provider portal is similar in nature. The only difference between a patient portal and the pharmacy portal is that the pharmacy portal has the application feature that allows pharmacies and providers to apply for grants on behalf of their patients. So pharmacies are able to apply for grants for new and existing patients. They can manage the grants, basically be able to tell what balance the patient has before they submit a claim, and they could also add new patients to the list of patients that they're managing in the portal. The pharmacy and provider portal also has the fund alert feature that allows pharmacies to get notifications when a fund is opened or closed, but they have to sign up for it. And it's also, let me go back here. It's also available on smartphones. It's mobile friendly. So that brings me to the end of navigating our patient portal. The idea is to also, basically empower our patients so they can, be able to help themselves. And please direct your questions regarding your existing application or grants to the grants@healthwellfoundation.org, or direct questions regarding today's webinar to myself, or you can either reach me by phone or via email. Same also for Jeremy, as it's listed over there. You can either call Jeremy or email him if you have any questions related to the webinar today. And at this point, we will open this up for questions.
Fantastic. So I'm going to, as everybody hopefully saw, this is Carla, and I grabbed the screen back. You should see the HealthWell Foundation slide with Jeremy and Fred's pictures up there. Don't worry, at the end of my PowerPoint slide deck, I also will have their contact information up. So, of course, a big thank you to Jeremy and Fred for taking time out of their day to share information about HealthWell and their expertise with the NeedyMeds audience. I would like to say I am quite proud of myself for sticking to my script when I introduced HealthWell, Fred, and Jeremy, because I really could have gone on and on about what a pleasure it is to work with the HealthWell Foundation team and how proud NeedyMeds is to be considered one of their partners, but I knew that the presentation would speak for itself. I'm so glad attendees were able to see and understand not only the breadth and scope of the help they provide for underinsured patients, but how easy it is to apply for that assistance should you need it. And I think that's really important. And as you can see, Jeremy and Fred speak for the rest of the HealthWell Foundation team. They take that quite seriously. They want it to be a smooth, easy process for people that do need the help. And again, I'm going to remind you to submit questions by typing them into that question section of your GoToWebinar control panel. In the meantime, as those questions come in and before I ask our HealthWell presenters to answer them, I do want to remind everybody that NeedyMeds is here to help as well. I pointed out these healthcare savings resources. I pointed out in the beginning that if you're looking for healthcare savings options, you should check out that patient savings tab. And here are some of the most popular and most popular and efficient cost savings programs you can find under that patient savings tab. So I suggest if you'd like to learn a little bit more, visit that patient savings tab, reach out to one of our call center counselors, or visit one of our monthly NeedyMeds overview webinars. And speaking of webinars, look at that segue. Here are some other ones coming up for later this month and through October, which I can't believe it's almost already October again. And again, you can sign up for those on the calendar of events on the bottom right hand of our homepage. So I'm going to go ahead and get to some of those questions coming in. And as promised, I'm leaving up Fred and Jeremy's contact information, as well as questions to reach out to HealthWell Foundation for inquiries about your existing application or grants. At the bottom of the screen, you'll find my email address, Carla with a C at NeedyMeds.org, the NeedyMeds website, and the 800 number. So one of the questions coming in, and I'm guessing you may get this quite a bit. Fred, I'm going to direct these to you.
Yes.
This first question coming in, and like I said, I think you probably get this a lot, and this is, am I able to apply for more than one fund?
Yes, thank you, Carla. And the answer is yes, as long as the person applying is eligible for that fund. Basically, as Jeremy stated, you have to have been diagnosed for that disease state and have insurance and fall within the a particular FPL or federal poverty level, whether it be it 400% or 500%. As long as those things are met, yes, we have patients that are enrolled in 2 to 3 funds. It's not out of the ordinary.
Oh, great. That's good to know. And thank you for our audience for participating with those questions. There is a question coming in. I think it's a question for me about medical transportation help. You may have noticed on one of my previous screens, I had a list of those healthcare cost savings programs that you can find under that patient savings tab on needymeds.org. And one of those is medical transportation. And the question is the medical transportation help only for those who have certain diseases? And that's a great question. The answer is, it depends. When you go into that medical transportation section of our website, you will be able to find assistance for transportation, certainly by looking through an alphabetical list of diagnoses, but you can also see what medical transportation is available geographically. So I would say check out that section, see if you can find one that applies to you or your loved one or patient or client's situation. If not, please check back because we regularly update the programs on our website. And don't forget to reach out to our call center counselors if you can't find what you need on our website. The reason being, they may have some outside the box ideas to help you with your medication costs in general. But thanks so much for that question. So, Fred, I'm going to direct another question to you that's coming in from an audience member. And this is another great question, which is, if I am approved for a grant, how long will my enrollment remain active?
Sure. So each grant is for 12 months. So a person is approved for a grant for a period of 12 months, at which point the grant ends. But the good news is that they are able to re-enroll 30 days before their current grant is ended. I don't know if that helps. So they have access to the fund as long as there is a balance on the grant for a period of 12 months, and they can re-enroll 30 days before their grant is enacted.
Yes, that was definitely a thorough explanation and another great question. Another one for you, and I'm glad one of the attendees asked this because it's one that I actually would have asked myself, which is, do funds ever close, and if so, why?
Good question. Yeah. The answer is yes. Funds do close. There are certain funds, a few funds that, since you know, I have known we've never closed, but those are very few and far between. Funds do close because the funds are supported by our individual and corporate donors, and also funding that comes directly from HealthWell Foundation itself. So whenever we ran out of funds, we close the fund. You can think of it as buying a ticket to fly on a plane. As
Hmm.
there's only a limited number of seats. So as we reserve seats for people and we ran out of the seats, we just close the fund, just as an airline will stop, taking in reservations.
Oh, I like that analogy. That makes a lot of sense. And thank you for the question, which actually leads into the next question really well. And this will probably be the last question that we'll sum up today's presentation with, which is, if I am enrolled in a fund that does close, how does that affect my grant?
Good news is it doesn't affect your grant at all. Like I said earlier, each grant has a period of a 12-month period within which the patient can have access to the grant. So when the fund closes, it basically means that we can no longer take additional enrollments. We can't. The seats are full. If you think about that airline example that I gave, that's all that it means. That we can't take any more applicants. But if you have a grant already, you have it for 12 months to use up the grant.
That's another important question. So, as I said, I do like to keep the question section relatively brief. So, thank you to those of you that participate in the question and answer portion of the presentation. And I know I've said it before, but a reminder, if we didn't get a chance to answer your question, we will follow up with you by email. But you can always reach out to either the Healthwell Foundation or NeedyMeds prior to that. You can find copies of our PowerPoint presentations in that handout section of your GoToWebinar control panel. Now, after this presentation, everyone will receive a follow-up email, and it will have a recording of today's presentation, but we are also working to convert today's presentation into a video to be posted to the NeedyMeds YouTube channel. I think it's a great idea to subscribe to the NeedyMeds YouTube channel. That way you'll be notified when new content such as videos, webinars, or presentations are added, and you won't miss out on anything you're interested in. So with that, I want to thank everybody for taking time to join us for today's presentation, and a big thank you to the Healthwell Foundation team for their partnership, for the important work that they do, and for taking time to share their expertise with NeedyMeds users and friends. Have a wonderful rest of the day, everyone, and thank you.